Hi, everyone. Welcome back. We're going to finish out our lecture 24 on mood disorders by talking about post-traumatic stress disorder, which is one of the family of anxiety disorders. We previously talked about generalized anxiety disorder. Now we're going to talk about PTSD. So what is this? This is a condition that does not always, but can develop after a highly traumatic event. So things like war, mass casualty events, natural disasters, sexual assault, severe violence, these types of really horrible situations that people endure. And what we find is that there are about 30% of folks who endure a trauma will develop some level of PTSD. There's a strong genetic predisposition, so there's something genetic, right, at play here. But interestingly, there are some behavioral interventions that can help prevent it or decrease the likelihood of developing it after a traumatic event. So accessing counseling and interventions after enduring a trauma is going to be important to help prevent this from developing. What are the symptoms of PTSD? They're generally in 4 different categories. One is re-experiencing, or as this graphic from Cleveland Clinic calls it, intrusion. These are flashbacks and nightmares. So flashbacks is, somebody could be walking down the street and then all of a sudden this memory of this really horrific, traumatic event it's almost like they're reliving it right there and then in that moment. So really strong memories that activate, sometimes in response to a trigger, sometimes out of nowhere. And then they can also activate at night. So nightmares of the event, about the event. So constantly re-experiencing this really horrible event and kind of being re-traumatized by it is one of the hallmarks of this condition. Not surprisingly, then, a lot of people develop avoidance, right? So they're going to avoid things that might potentially trigger these memories. Any reminders of the event, they won't talk about the event, which can then be problematic because you lose the opportunity to process it into a more stable and less triggering memory. They will take down pictures that of maybe the person that was involved or whatever it might be. So avoidance is the second part. And then the third part I want to talk about is this hyperarousal. So this is like being constantly on edge and very reactive and jumpy and fearful. So people with PTSD are often very irritable. They're prone to angry outbursts. They're kind of just like on a hair trigger a lot of the time, right? So this, their kind of sympathetic nervous system is primed and ready to go, and they can lash out at any moment, which of course causes significant problems in relationships and their daily life, work, school, all types of functioning. And then we also see changes in thinking and mood. So a lot of negative thinking, that this is never going to get better. I'm never going to be able to be functional. My life isn't worth living. And then also some cognitive things. So like forgetting things about the event or not being able to recall things or having trouble concentrating just in regular life. So changes in mood and cognition also develop. What do we know about what's happening in the brain? So given what you already know about emotions and the brain, you will not be surprised to hear that we see increased activity of the amygdala. So remember, that's the part of the brain that does emotional processing and is especially good at fear. And that is the part that signals the hypothalamus to activate the sympathetic nervous system and potentially the hypothalamic pituitary adrenal axis as well. So the amygdala is overactive in people with PTSD. We can see that on functional MRIs. It's definitely part of what the problem is. And then their reticular formation is also overactive. So the reticular formation sets your overall level of alertness, right? So if you have an overly active reticular formation, you can't relax, right? You can't just chill out. You can't mellow out. You're always on edge. We also see altered functioning in the hippocampus, which if you think about it, with these re-experiencing and these memories kind of coming up constantly, that makes sense because we know the hippocampus is involved in memory. And also largely reduced activity in the prefrontal cortex and the anterior cingulate cortex. Now remember, the prefrontal cortex is part of using past memories to interpret our current situation, right? And determine our emotional response to that situation. And if you are less able to do that in a rational way, which is the kind of special talent of the prefrontal cortex, is to be very rational, then it makes sense. Then that things would be triggered pretty easily. And you might remember that the anterior cingulate cortex is that part for emotional regulation. Okay, I'm feeling this emotion now. How do I respond to it versus how can I kind of control it? So hopefully this has given you a nice opportunity to review some of the things we already talked about brain regions and their role in emotions. How do we treat PTSD? So certainly psychotherapy, and medications can be used to treat some of the symptoms, right? They don't really treat the actual problem, although there's some interesting research looking at using some dissociative psychedelics and other things. Right now, that's not mainstream. One of the things that's really interesting and a very powerful therapy for PTSD is something called EMDR, which stands for eye movement desensitization reprocessing. And what happens in EMDR is that a therapist, after getting to know someone, establishing trust, creating a safe environment, will have them recall a traumatic event, a traumatic memory that they have, while having them follow their fingers with their eyes and go back and forth. Now, sometimes it's follow my fingers with your eyes. Sometimes it's tap, your hands. It can be a variety of different things that are alternating from one side to the other. And it is inordinately helpful in decreasing kind of the emotional loading associated with a memory, the horror, the shock, the fear. It's able to just kind of dampen down and eventually kind of wash away much of that excessive emotion that's tied up with that memory. We think this is because, as we talked about before when we talked about memory, every time you retrieve a memory, then you reconsolidate it, right? And you restore it. So every time, remember we talked about before how every time you recall something, it's like opening a file on your computer, you can edit it. Yes. And that's why sometimes our memories are not very reliable over time. We can be very suggestive and remember certain things and not remember others, or exaggerate certain things, or even sometimes believe things happened that didn't. So this is one of the reasons why memories are unreliable, but it also gives us an opportunity when you have a really traumatic memory to then alter that memory in a way that makes it less threatening, less difficult for the person. So this is a really exciting therapy option, which is like, I don't know how somebody came up with it in the beginning. I don't know why, though, alternating other sides, people have a lot of hypotheses over why that is. They think maybe your working memory is just so busy trying to do too many things at once that you just lose some of the emotional qualities associated with the memory before you then restore it again and reconsolidate it. Fascinating, interesting stuff. There's a media assignment to watch a video about it. So in summary, PTSD, post-traumatic stress disorder, is something that can develop after a traumatic, horrible event. Not everyone develops it, and certainly there are things that you can do to decrease the likelihood that you will develop it, mostly through supportive counseling and processing the event and the memory in a healthy way, rather than avoiding it and pretending it didn't happen. That tends to be problematic. Symptoms include re-experiencing, which is flashbacks and nightmares, hyperarousal, always being on a hair trigger, lashing out, being irritable, and mood and cognitive disturbances. Oh, and I think I skipped avoidance, so avoidance as well. And we know that we see increased activity in the amygdala and the reticular formation, altered activity in the hippocampus, and decreased activity in the prefrontal cortex and anterior cingulate cortex, all of which makes sense given the symptoms of PTSD. Psychotherapy, sometimes medications for symptoms, and EMDR can be very effective. So if you or someone you know ever is suffering from this condition, there is help available. All right, that's it for our lecture on mood disorders.